I next invite Dr. Subijay Sinha to come to the podium and deliver his talk. He is a director of Drishti Deep Eye Institute, Dankuni. He has completed his post-graduation from RP Center and did senior residency in Unit 1 in Retina. Over to you, sir.
Very good afternoon to all, and thanks to Bibhuti for inviting me to present my limited experience of using tPA in various submacular hemorrhages mainly. I haven't used in suprachoroidal hemorrhages and other conditions. So mainly all the videos have shown CNVM, PCV, RAM associated submacular hemorrhages. So I will, there are other options are only anti-VEGF plus gas plus tPA, gas or VR surgery to drain the blood, and the subretinal tPA plus gas. So this is the retiplase we are using. The doses are 25 microgram per 0.1 ml of BSS. This is 41 gauge cannula from Med1. So I will show the first case. Where are the videos? उसके साथ था ना videos? इसको बंद करो जरा.
So did you have it embedded in them?
No. In the enter folder I had.
Okay, sir.
Folder कहाँ है? हाँ इसका right. हाँ, this was the case. Had dense vitreous hemorrhage. So and the ultrasonography done previously, it was revealing that there was some macular hemorrhage. So after clearing the vitreous, we can see there is a fresh submacular subretinal bleed. So I am injecting just outside the arcade in multiple places actually. The blister formation. Because it was a very big submacular bleed, subretinal and submacular, entered almost 3/4 fundus was, almost 2/3 fundus was involved. In 3 places I actually injected and did air fluid exchange and SF6 gas with prone position. So post-op after this is post-op after 1 month. We can see there's pretty very good resolution, but I can see there's a RP rip, but it's away from the macula. So the vision ultimately came to 624, but I have given only one anti-VEGF. After that, patient has not come for follow-up. Maybe she will come with again one more episode of rebleed, because only one anti-VEGF was given, and I have not been able to give an anti-VEGF. Then next case, this was a case of RAM. This was a case of bleed, RAM, pre-retinal bleed and subretinal bleed both. So this was a small bleed, only intravitreal tPA plus gas could have also worked, but as there was a good amount of pre-retinal bleed, I decided to go for surgery with subretinal tPA. So after clearing the pre-retinal bleed, I am clearing this pre-retinal hemorrhage. So I can see the submacular bleed. Now see what happened. There will be blowout. I injected once. I thought I should inject once more. We can see. So I noticed there was a blowout. I didn't do ILM peeling at that setting. So in the follow-up, videos in the follow-up I found the full thickness macular hole. एक और वीडियो 2A है ना उसका सर, आइकॉन कहाँ जा रहा है? 2A बस हाँ हाँ. In the follow-up there was a I had to do the vid lavage along with ILM peeling for the macular hole and put C3F8 gas and prone positioning for 2 weeks. Did air fluid exchange and injected gas. So in the post-op say after 1 month, I can see the hole has closed and there is full resolution of the bleed, but there is some amount of edema in the paramacular area. The foveal contour is getting to maintain. So I am following it up. It is pretty good results. Case 3, this was a case of vasculitis. It was slightly unusual case. Vasculitis, I did angiography, peripheral huge CNP areas, vasculitis with submacular bleed. So I decided to go for the surgery. I'm doing the vitrectomy. Doing laser for the periphery because there was a huge CNP areas. I had done the angiography previously, and then I am dealing with the submacular bleed. As the bleed was around that arcade only, I had to inject inside the arcade, but fortunately there was no blowout, and the blister occurring. Yes. And air fluid exchange. In the post-op, 1 month post-op, not 1 month, around 2 weeks post-op, is a very good resolution of the subretinal bleed and the gas bubble I can see. So I have done around 20-25 cases till now. This is one more case. I don't have the video, but and this is the post-op of that submacular bleed with the vasculitis. I can see the foveal contour maintained very well. These are some of the other patients. I don't have the videos of these patients. This is a big submacular bleed due to PCV. After single injection of subretinal tPA, I can see the resolution of the bleed with very good foveal contour. And this is one more patient, is a very big submacular bleed. And in this case there was a RP rip, but it was away from the fovea, so the vision improved to 624. I managed to give 2 anti-VEGFs, and the patient has not followed up after that. this was one more. This was in my initial times. I was searching for cases. I think in this case only intravitreal tPA and gas would have been sufficient. But I did surgery, and the result was quite good. So in my limited experience, say for last 6 months, 8 months, I have done 25 cases. Not all cases have good results. These are mainly good results cases, and 1 or 2 cases have failed. There was one cases he developed more hemorrhage with hemorrhagic choroidal detachment after giving injection. I tried to do surgery, but I failed to do anything. And 2 or 3 cases needed vid lavage definitely after that in subretinal tPA. But all other cases are doing quite well.